Now, the other focus on the show is vaccines and the question of how long vaccine protection lasts. Two new preliminary studies have found that immunity to coronavirus lasts at least a year and probably much longer and improves over time, especially after vaccination. The issue of immunity, remember, is something that is much debated, and vaccine protection. Now, together, these studies suggest that most people who have recovered from COVID and who are later immunized will not need any boosters. Vaccinated people who were never infected most likely will need a booster shot. Well, to talk more about this entire issue and what it means, we're now joined by Dr. Rachna Kochariya, public health physician, epidemiologist, and Dr. Giridhar Babu, Professor Head Life Course, Epidemiology, PHFI, Bengaluru. Thank you so much, doctors, for joining us. Dr. Babu, first to you, what is your view on these findings? And I'm sure, of course, this is not the last we've heard on this issue of vaccines and how long the protection will last.
Yeah, thanks, Gagi, for having me on the show. So there are two things that these studies indicate. First, for those who are already infected with COVID-19 infection earlier, there is this bone marrow cells which have the memory to be able to mount an immune response whenever there is the wild virus. This is in resting phase till such a time when it is required. So that's what one study has shown. In another study, what they indicate is in terms of those who already had an infection and they're also vaccinated, then the efficacy is even greater, which is both good news. But in terms of how long the protection lasts, we are learning as we are moving with the COVID-19 pandemics. Definitely vaccine helps. Vaccine helps in both unvaccinated and also those who have had infection in the past. So that's a good news, Gagi. That's I can say as initial remarks.
All right, Dr. Kochariya, the interesting point is, how it differentiates about people who've had the infection and then get vaccinated and how they will have protection for much longer. And I'm interested here because I'm one such person. I've had the infection. I did get the vaccine. Of course, I'm waiting for my second dose. But so the immunity could last a lot longer than, earlier what was being predicted.
Right. And thank you for having me as well. This is what this early data, a couple of studies are suggesting. It's very early. They're surmising right now. We have to be very careful with the words that we use. And certainly even before, this study, we do know this, that an infection generally will give you a more holistic, robust immune response, as well as the memory B cells that were tracked in this particular study. And it was good that they did it. They found, proof all over again. And you rightly said that those people who had the infection and then went ahead to get that one vaccination shot had a very good immune response versus those who just had two vaccines. And I wouldn't say they clearly state that they are not right now able to say, the two are different. One can't say one is better or the other. The two are different. Certainly you get a good response, immune response with two vaccinations, and it is different from the person who got the actual disease and then got the vaccine, for sure. But early days, and we will look for further science, as Dr. Babu also said, as more and more people are getting vaccinated and those who had the disease are getting vaccinated, we look forward to studies both from the West as well as our own.
Right. Professor Babu, now the reason this is very important about how long the protection lasts is because, if we talk about our own vaccine drive, it's moving very, very slowly. We're hoping the government has said by the end of the year that the adult population at least will be vaccinated. But then the worry is if there is this immunity erosion, then would it be that by the time we reach the end of the year, many people who got the vaccine earlier are again now susceptible to the disease and, perhaps we won't reach that herd immunity. Your view on that and why this is so important?
Yeah, I think that's a really great question. So now, those who are vaccinated are definitely protected because there is wide-ranging immune response that they'll have. And even these studies only show that doing vaccination, even if you're infected, is better. Whereas if you just look at those who are infected, it's not complete protection. And also, there is also the severity of the illness, which might lead them into critical care and even in extreme cases death. So the wrong lesson here is okay, if you are infected and then get vaccinated, maybe then that's better. That's absolutely not the correct inference from these studies.
Right.
So in order to have population protection, we have to increase the speed of the vaccination. There's no doubt about it. You rightly stated in the beginning of your show, 8 million doses. My estimation say 10 million doses per day, at least to ensure that all the vulnerable are covered ahead of the next wave. That's what can guarantee us reduction in mortality and the critical care needs.
Right, and we're also still seeing cases of reinfection, Dr. Kochhariya, even after the vaccine, people are getting infected. So that raises questions on this issue of immunity, though we do know that the vaccines that we have are, somewhat between 70 to 80% efficacious.
Right. Although we are seeing infections in those people who had the vaccine, I will say both from my own experience as a physician, as well as colleagues, as well as the data coming in from people who are doing on-ground current studies, the severity of the infection is much less. If you compare the two groups of people who had infection after the vaccine versus not, a much lower percentage of people are landing up in the hospital. That difference is marked, and that's one of the reasons to ramp up the vaccination drives and get the vaccine wherever one can.
Right, and Professor Babu, I was also talking about the reinfection, that many people who've had COVID, after a few months, again they've got it. So that is also something that many are worried about.
Yeah, Gagi. So the proportion of people who are having reinfection is not really great. In my own estimates and also talking to the other virologists, it will not be more than 10%. And mostly it is mild, especially in those who had asymptomatic in the first go. But more important point is, if we are speaking of infections, breakthrough infections in COVID after receiving the vaccine, the vaccines are tested against preventing death and severe illness. So therefore, some amount of breakthrough infections, if they are mild and don't require hospitalization, should not deter from getting vaccinated. So these are two different things. Proportion of reinfections we need to study really well to understand. On the other hand, breakthrough infections after vaccine are mild or asymptomatic. Therefore, vaccination case is even stronger.